I'm sleeping, but I wake up every hour just making sure she's still breathing.
Sage is a 9-month-old healer mix that has immune-mediated hemolytic anemia, a disease where the body's immune system destroys its own blood cells. Dog owner Itzel Coronel says one day when Sage was running and hit a fence, she suddenly collapsed. That's when they knew something was wrong.
Specific triggers that we look for in these cases are things like some infections spread by ticks, which thankfully we don't have many of here. Some cancers can trigger this, and some medications can trigger it.
Coronel says on the day of the incident, her dog was very weak and her gums turned pale. She was also told that was the last day her dog would live. Fortunately, Sage is still here more than 2 weeks later.
She doesn't have as much energy as she usually has. She used to play a lot.
She also says that Sage has to go to the bathroom almost every 30 minutes as a side effect of the medication. She says Sage is always hungry and they had to make dietary changes from raw food to kibble to prevent infections. When it comes to others that may be dealing with this situation, Coronel has a word of advice.
Just don't give up. I think that was one mistake I did. I gave up too soon because it was going to be really expensive.
Right now, Coronel is not quite sure what the outcome will be.
We can't be certain how long she's going to live and if this medication is going to continue to work.
One of the life-saving measures for dogs with hemolytic anemia is our blood transfusions. And not every dog with this condition needs a blood transfusion, but in some, that's what we have to do to keep them going long enough for the medications to take effect.
In Bend, Bolabarebo, News Channel 21.